Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, so have you ever had one of those days where your brain feels completely fried,
Mm.
you know? Like you're trying to think, but it's like wading through mud?
Yeah, I think we all have those days from time to time, right? Like, especially if you haven't slept well or if you're stressed out or something.
Right, exactly. But imagine that feeling not just as a once in a while thing, but like almost constantly. And coupled with that, what if every time you stood up, the room kind of I don't know, tilted a bit, like you're on a boat, your heart starts racing and that mental fog just gets 10 times worse.
Yeah, that sounds pretty awful, honestly. And I know we've talked about chronic fatigue before on the show, but this sounds different, right? Like more than just being tired.
It is. What I'm describing are some of the hallmarks of postural orthostatic tachycardia syndrome. It's often called POTS for short, and it's a condition that affects the autonomic nervous system, which basically controls all the stuff in your body that you don't have to think about, like your heart rate, blood pressure, digestion, things like that. So with POTS, something as simple as standing up can trigger a whole cascade of symptoms, things like dizziness, that brain fog we were talking about, a rapid heartbeat, and just this overwhelming sense of fatigue. And it often hits young women particularly hard.
Yeah, and it can be really tough to diagnose and manage too, right? Because the symptoms can be so varied and sometimes even seem kind of vague.
Exactly. And that's one of the reasons this deep dive is so important, because we're going to be looking at some groundbreaking research that might finally be giving us a clearer picture of what's going on in the brains of people with POTS.
Okay, I'm intrigued. Tell me more. What kind of research?
Well, researchers at the University of Adelaide in Australia have used a special kind of brain scan to look at blood flow in the brain. This type of scan is called single photon emission computed tomography, or SPECT. It basically allows them to create a 3D map of blood flow in the brain, showing which areas are getting enough blood and oxygen and which ones aren't.
Oh, so they're basically looking for areas of the brain that might not be getting enough fuel, so to speak, which could explain the cognitive problems people with POTS experience.
Precisely. And the really interesting thing is that they found a really strong link between reduced blood flow in certain areas of the brain and the severity of brain fog in people with POTS, even when they were lying down.
Wow, that's fascinating. So even at rest, their brains aren't getting the blood flow they need.
That seems to be the case. And that could have some really big implications for how we understand and treat POTS, and even other conditions with similar symptoms like long COVID.
I see where you're going with this. Okay, so where do we start? Do you want to break down exactly what this study involved?
Sure. So the researchers wanted to investigate whether reduced blood flow in the brain could be a root cause of the cognitive impairment, the brain fog, that so many people with POTS report.
Makes sense. So how did they set about doing this?
Well, they teamed up with the South Australian Health and Medical Research Institute, and they analyzed single photon emission computed tomography brain scans. Remember, those are the scans that show blood flow in the brain. They had scans from 56 people with POTS who had all reported significant problems with brain fog.
Okay, and to be clear, these scans were taken while the patients were lying down, right? Like at rest.
You got it. And that's what makes the findings so interesting. They discovered that a whopping 61% of these individuals showed reduced blood flow in certain key areas of the brain, even though they were just lying down.
Wow, 61%. That's a pretty big chunk of the study group. So it's not just about the blood flow issues that might happen when they stand up. Something else is going on here. What specific areas of the brain were they looking at?
Great question. The brain regions that were most affected were the ones involved in what we call executive function.
Okay, so executive function, for people who maybe haven't heard that term before, is kind of like the brain's management system, right? It helps you plan things, organize your thoughts, make decisions.
Exactly. It's what allows you to stay focused, multitask, and think clearly. And when these areas aren't getting enough blood flow, it can seriously mess with those abilities.
No kidding. It makes total sense that that would lead to brain fog and trouble concentrating.
And that's not all. They also saw reduced blood flow in areas involved in sensation. That's like your sense of touch, temperature, pain, and also in areas that control movement.
Okay, so this could potentially explain why some people with POTS also experience things like sensory sensitivities, or maybe even have trouble with coordination or balance.
Right. It really starts to connect the dots.
This is really interesting stuff. So what about the people who developed POTS after a coronavirus infection? The article mentioned them specifically, right? Did they find anything different in that subgroup?
They did. The study found that among the subset of patients whose POTS seemed to have developed after a coronavirus infection, a full 75% showed this abnormal brain blood flow pattern.
75%. So a notably higher percentage than the 61% overall. That definitely adds more fuel to the fire, so to speak, regarding the connection between viral infections and the development of POTS. But they also looked at other potential triggers, didn't they, like physical trauma or surgery?
Yeah, things like injuries, surgeries, or even pregnancy are also known to sometimes precede POTS.
Right, right. So what did they find when they compared those folks to the post-COVID group? Was there a difference in terms of how often they had reduced brain blood flow?
Interestingly, no. The study found no significant difference in the prevalence of reduced brain blood flow based on the reported trigger for their POTS. So it seems like the blood flow issue is present across the board, regardless of what might have initially triggered the condition.
Huh. Okay, so to summarize, reduced brain blood flow seems to be a common factor in POTS, regardless of the initial trigger, though it was a bit more common in those whose POTS followed a COVID infection.
Exactly. And the implications of this are pretty huge.
Yep.
I mean, first and foremost, it provides the first clear evidence linking the cognitive symptoms of TOTS, that brain fog, to a measurable physical change in the brain.
Right. And that's so important because for so long, these cognitive symptoms have often been dismissed or attributed to anxiety or depression or just being, a worried well kind of thing. But this study shows there's a real physiological basis for these problems.
It really validates the experiences of people who've been struggling with these symptoms and maybe haven't felt heard or understood by their doctors.
Totally. This could be a real game changer for how POTS is diagnosed and managed in the future.
And it also raises the possibility that reduced brain blood flow could be playing a role in other conditions that share some of the same symptoms as POTS.
Like, for example,
Well, the most obvious one would be long COVID. A lot of people with long COVID experience profound fatigue and cognitive difficulties, and this study suggests that those problems might also be stemming from issues with blood flow in the brain.
that's a really important connection to make, especially given how many people are dealing with the long-term effects of COVID-19.
Absolutely. And think about how much reduced blood flow in these key areas, executive function, sensation, movement, can really impact someone's ability to function in their daily life.
Yeah. I mean, it's one thing to talk about reduced blood flow in the abstract, but when you think about how that translates into real-world difficulties, struggling to concentrate at work, having trouble processing information, maybe even experiencing increased sensitivity to light or sound, it can be incredibly debilitating.
And as the researchers pointed out, this can have far-reaching societal implications too, especially because POTS often affects young people, predominantly women. They express concern about the impact this could have on their education, their careers, their overall quality of life. It's a huge issue that deserves more attention.
Totally. It highlights the urgent need for more research to fully understand what's going on here and how we can better help people with POTS and other related conditions.
And the researchers themselves were very clear about that in their paper. They called for more research to figure out the underlying mechanisms behind these blood flow abnormalities in POTS and similar autonomic disorders.
Which is super important because without a good understanding of why this is happening, it's tough to develop effective treatments, right?
Right, exactly. But of course, like with any scientific study, it's crucial to acknowledge that this particular study did have some limitations.
Right. No study is perfect, and understanding the limitations helps us put the findings in context. What were some of the key limitations they highlighted?
Well, for one, the study was retrospective. That means they were looking back at data that had already been collected, rather than designing a study from scratch to specifically answer this question.
Okay, so they weren't able to control all the variables in the way they might have if they'd designed a prospective study. Got it. What else?
And it was a single-center study. So all the participants came from one medical center in Australia. That means the results might not be perfectly generalizable to people with POTS in other parts of the world or in different healthcare settings.
Makes sense. Was there anything about the way they measured brain blood flow or cognitive function that they flagged as a potential limitation?
Yeah, a couple things. First, while the patients in the study had reported experiencing cognitive problems, they didn't actually undergo formal cognitive testing at the time the brain scans were taken. So the researchers couldn't definitively link the degree of reduced blood flow to specific types or severity of cognitive impairment.
Ah, I see. So they know there's a connection between reduced blood flow and cognitive issues, but they can't say, for example, this much reduction in blood flow in this specific area equals this much memory impairment or something like that.
Exactly. It's more of a general association at this point.
Okay, that makes sense. What about the way they defined abnormal blood flow? They mentioned using something called a Z-score, right?
Yes. A Z-score is a statistical measure that basically tells you how far away a particular data point is from the average for that group. So in this case, they used a Z-score to compare the blood flow in each patient's brain to the average blood flow in a database of healthy people. They set a certain cutoff point, and anything below that was considered abnormal, but they acknowledged that some people might have blood flow that's just slightly below that cutoff, and it might still be clinically relevant for them, even though it wouldn't be classified as abnormal according to their definition.
Right, so there could be some nuance there that they weren't able to capture with this particular method.
Exactly. And another limitation is that they only used SPECT scans. They didn't use any other types of brain imaging, like MRI or PT scans, which can provide different and potentially complementary information about what's going on in the brain.
Okay, so it's important to view these findings as part of a bigger puzzle, not the whole picture.
Exactly. And they also mentioned that the control group they used wasn't perfectly matched to the study participants.
Ah, the control group. That's always a crucial element in research. So remind me, how did they select their control group?
Well, instead of recruiting a separate group of healthy people and scanning their brains, they use a commercially available database of SPECT scans from healthy individuals. And while this is a common practice, it means the control group might not have been perfectly matched to the study participants in terms of things like age and sex, which could potentially skew the results a little bit.
Okay, so those are some important things to keep in mind as we interpret the study findings. Now, I'm curious to know, what did the researchers themselves say about the implications of their work?
Well, one of the lead researchers, Dr. Seeley, highlighted the fact that this is the first clear evidence of poor brain circulation in POTS, even when patients are at rest, using a widely available imaging technique.
And that's really important because it means this type of testing could potentially be integrated into routine clinical practice. Right.
Exactly. And Dr. Seeley also emphasized that these findings could have implications for understanding brain fog in other conditions, not just POTS. And she reiterated the concern about the disproportionate impact of POTS on young women and the potential long-term consequences for their lives.
Did they say anything about potential directions for future research?
They did. They suggested that future studies should investigate whether therapies that are currently used to manage the autonomic nervous system dysfunction in POTS, things like exercise programs, medications to regulate blood pressure and heart rate, and dietary changes can also improve blood flow in the brain and ultimately improve quality of life for people with POTS.
Okay, so that's a really important next step, not just identifying the problem, but figuring out how to fix it.
Right. And this is really just the beginning of this line of research. There's so much more to learn. But this study has definitely opened some exciting new avenues for understanding and treating POTS.
I agree. So to wrap things up, what's a key takeaway you want listeners to ponder after this deep dive?
I think the big question this study raises is this. If reduced brain blood flow is indeed a key factor in POTS symptoms, and potentially in other conditions, what new possibilities does that open up for diagnosis and treatment? It's a question that deserves a lot more attention.
And I think it's really important to emphasize that recognizing the physical basis for these often invisible illnesses can foster greater empathy and understanding for those who are struggling with them.
Totally. And we always encourage our listeners to dig deeper if they're interested. If you want to learn more about the specifics of this study, we encourage you to check out the original research article, which was published in the journal Scientific Reports. And if you're experiencing any of the symptoms we discussed, please don't hesitate to talk to your healthcare provider about this research and what it might mean for you.
Couldn't have said it better myself. Keep those conversations going and keep learning.
Always. That's what this deep dive is all about.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.